So this is the assimilation video regarding patient assessments. I chose to do a medical assessment, being dispatched to a 56-year-old female complaining of difficulty breathing. I don't have any resources with me. I'm arriving alone, so I'm going to request additional ALS. I'm requesting a transport rig, also requesting a supervisor in case of the need for intubation. If the patient were to desaturate quickly, I would request a helicopter due to us being in a rural location. At this time, I don't see the need for C-spine immobilization. She is my one single patient. Her nature of illness is going to be respiratory related. How are you feeling?
A little bit short of breath and tired.
Okay. When did that start?
Well, I was sick about a month ago. And was in the hospital and then was better, but now I'm starting to feel, the last couple of weeks, starting to feel tired and fatigued and a little hard to breathe again.
Okay, so I know at this point that my patient is alert. She is conscious. She's GCS 15. She's able to appropriate all of her movements, making appropriate conversation. So she is alert. Her airway is maintained. It is patent. There is no need to suction, no reason to place an adjunct or anything like that. So at this time, I'm just going to monitor for any issues with that. Her trachea is midline. Her jugular veins are non-distended. As far as her lung signs, I assessed them prior to this video just to keep things moving along quickly. She does have fine crackles in the right lower bases. Left is clear. So right does have the crackles. As far as her chest movement, chest wall moves symmetrically, bilaterally. Chest rise is equal, so we don't have any chest wall defects or anything like that. Circulation-wise, her skin is, well, I'm really cold, so you feel warm. What do you feel like?
I feel cold.
You feel cold. Your skin feels warm to me. You're pink, you're dry. Your cap refill is 1, 2.5. So you're a little bit diminished. I do have her on a pulse ox at this time. Due to her complaint, I'm going to go ahead and put her on 15 liters via non-rebreather. She doesn't look that bad, but she is, at the time of starting this video, at 82% in real life. Right now she's sitting at about 89, so I go ahead and put her on a non-rebreather. We go ahead and start a breathing treatment of albuterol on her at 2.5 milligrams with saline dilution. Run it at 6 to 8 liters per minute of oxygen. If I did have ipratropium bromide Atrovent available, I would give her the ipratropium. Most agencies don't carry it due to the cost, but I would go ahead and administer ipratropium because it's beta-2 selective. So that would be better with her with possible CHF complications since it is beta-2 selective. I don't see a need at this time. Her blood pressure when I assessed it was 142/70. I don't see a need at this time to intervene further. So we're going to go ahead and proceed with rapid transport. Her pulse is 68. She typically runs about that. It's strong. It's regular. I would go ahead and place her on a 12 lead, run a 12 lead, which I'm presuming would come back normal sinus rhythm. I know she, just off of my experience, does have a first degree heart block, so I'd monitor for that. She's running at 67 right now, and that's confirmed manually. So we go ahead and proceed with our rapid transport to Cox South.
Yes.
So what does your difficulty breathing feel like?
My chest feels real tight.
Real tight. And it feels tight right here, you say?
Yeah.
Right down the middle? So like underneath your sternum?
Yes.
Okay, so she's got substernal chest pain, but it's pleural in nature. It's not cardiac in nature from the way that she describes it. Do you have any allergies?
No.
Medications do you take?
Several.
I know this better than you. She takes carvedilol. She takes hydrochlorothiazide. She takes losartan and simvastatin. So she's got a typical drug regime for someone her age. She does have hypertension, correct?
Yes.
And that's, other than anxiety, the only thing you've been diagnosed with.
Yes.
Okay. So as far as your past history, tell me a little bit about your hospitalization that you had.
Well, what
What did you get hospitalized for? What was your diagnosis?
Pneumonia.
Pneumonia.
Atypical pneumonia.
Atypical pneumonia. And so what led you to go to the hospital that day?
Difficulty breathing.
Okay, did you wake up blue? Did you collapse? What, you walk in and just can't breathe? What happened?
It was gradual.
Gradual?
It was gradual, yes. And then it, like the last 2 days were where I couldn't even walk from point A to point B without running completely out of breath and having to sit down.
Okay. Now, did you get intubated while you were in the hospital?
No.
Did you go on CPAP or BiPAP?
Yes.
Yes. Okay, how many days were you on that?
Overnight.
1. Okay. So we know that her recent hospitalization was relatively significant. Intubation and CPAP are things that we want to look for in respiratory patients to understand just how serious the last thing was. So I know to take her quite seriously. I know that they also gave her albuterol treatments then. What's the last thing you ate or drank?
Today?
Mm-hmm. Did you eat today?
Yes. Oh, cashew chicken.
Cashew chicken. Was it good?
Yes.
All right.
At about 1 o'clock.
Okay, so what led up to, so like in the couch earlier, you said you were really tired, and so we're going to say that's when you called 911. What led up to that?
Just,
I believe you had a coughing fit.
yes.
Yeah. So when you cough, does that bring on the difficulty breathing?
Yeah.
Does it ever happen when you're just laying in bed like this? Are you ever like, oh man, I just can't breathe? Or is it only when you're up moving around?
Mostly when I'm up moving around.
Are there times when you notice that it's better? Does taking a hot shower make it better? Or sitting up?
Yeah, sitting up.
Okay. Does it help to dangle your feet off the edge of the bed?
I don't know.
Don't know? Okay. So, as far as today, the onset of her difficulty breathing was relatively acute. She has 2 different things going on right now. She has a chronic difficulty breathing that we're currently trying to deal with, and she had an acute exacerbation today while sitting on the couch following a coughing spell. So what provoked that was some deep breathing, listening to lung sounds that provoked coughing. Did that pain or difficulty breathing, that tightness, did it go anywhere, or did it just stay in your chest?
It stayed in my chest, but it's also at the very bottom in my back too.
Okay.
When I breathe in really deep.
Does that feel like your lungs, like you've said before, like, oh, that's my lungs, and you can tell? Okay. So on a scale of 0 to 10, 0 being I could like hike a volcano in Hawaii, kind of easy breathing, or 10, I'm gonna die right now. How difficult is your breathing right now?
10 is the worst.
10 is the worst.
Maybe like a 5.
Like a 5?
Or 4.
What was it on the couch earlier?
Probably like a 5 or maybe a
I know you were
6.
more tired than anything on the couch earlier. You just felt exhausted.
Mm-hmm.
Have you still been having the headaches?
Not very often.
Any nausea or vomiting?
No.
Okay. And so it's 7:32 p.m. right now. The time of onset for this would have been about 7:15. So I'm going to continue my interventions of albuterol 2.5 mg nebulized with saline, 0.5% sodium chloride. Again, if I had ipratropium bromide, I would go with that, beta-2 selective, because she was diagnosed with congestive heart failure in the hospital, so I would prefer a beta-2 selective over more of a broad-spectrum beta agonist, but I'll go with a beta-2 if I can. As far as Lasix, she hasn't brought up any of her CHF issues. There's no JVD. Her pedal edema is minimal. Her hands look great. The fluid on her lungs is thick and junky. It's not real fluidy, so I'm not super concerned about needing to remove fluid at this time. Solumedrol 125 mgs. After establishing bilateral 18-gauge IVs, I could do it with just one 18-gauge IV, but 2 would be great in case she decompensates. So I would also give Solumedrol as an anti-inflammatory. at 125 mgs. As long as she's tolerating everything great, we're going to continue with therapy. If she does decompensate, we can go ahead and move to either CPAP or BiPAP to try to push the fluid off, open up the alveoli, prevent the atelectasis. Morphine, do you have any pain or anything right now?
Mm-mm.
Okay, if she developed any pain, I could go ahead and go with 2 mgs of morphine, just to keep her comfortable, especially with it being chest pain. But right now, there's no need for that. We could probably stick with an NSAID or something like that. It would reassess vital signs. Right now, she's sitting at 89% in all reality. When I gave her albuterol, she increased to 99%, so I would go with that for now. Heart rate's down from 77 to 64, so that's an improvement. I'm going to continue my rapid transport to the hospital. I'm going to keep on going with my assessments. How do you feel right now?
I don't feel bad.
Okay. After that breathing treatment, do you feel a little better?
A little better.
I would go ahead and listen to her lung sounds again, see if everything cleared up, see if she's moving air a little bit better. I know her color looks a little bit better. Her work of breathing looks better. She's not exhausted. She's able, which she's not sitting up now, but if I asked her to, she would be able to. She's perked up. She's not as slumped over as she was before. So I am seeing improvement. You good?
I'm good.
All right.